and welcome to the Fitness Doctor on ESPN 730, the program where we address your exercise, nutrition, and overall health needs. My name is Troy Press, and now, an exercise physiologist in the School of Sports Sciences at Wingate University, the Fitness Doctor himself, the man who knows everything and anything to do with fitness and nutrition, Dr. John Acquaviva.
Thanks, Troy. Today we're going to be talking about common injuries common to those who work out or who are active recreationally, high school, college, or even pro athletes. And today our focus is going to be how to take care of these injuries and maybe even how to prevent them. Troy, what's in store for us today?
All right, Doc. Great show as always. Special in-studio guest. We have Tim Singleton in the studio. We have the quick Q&A with Dr. A, the social media breakdown, and fitness nuts in the news.
Perfect. Okay, let's get to it. My special guest today is Tim Singleton, the Director of Sports Medicine. In particular, Tim is an athletic trainer, which means he knows all things injury and the prevention of them. Isn't that true?
We'd like to say so, yes.
Okay, at least most of the stuff. Yeah, at least the stuff that will fit the ears to our listeners, right?
Exactly.
Thanks for being here. I know it was a long commute. People tend to think Wingate as a suburb of Charlotte, but actually it puts some miles on the odometer, doesn't it? Thanks for being here. All right, a little more on our topic of the day. Men's Fitness, a popular fitness journal, recently listed the most common fitness-related injuries. And today we're going to discuss some of those that are on that list. And we're going to touch on how to treat them and maybe even some cases prevent some of those injuries. And along the way, we hope to hear from our listeners who maybe can identify with some of the stuff we're going to be talking about. Troy, before we move on, give us the social media info.
All right, Doc, you got it. If you want to follow us on Twitter, Facebook, we keep it real simple here, The Fitness Doctor. It's WU, that's W-U, Fitness Doctor. And we have a special giveaway today. If you tweet at us this morning, at Woo Fitness Doctor on Twitter, the first person to tweet at us their favorite part of the show or a special fun fact of the day, you could receive a special Fitness Doctor shirt.
Actually, it's going to be the T-shirt that John Ware, our guest from a couple weeks ago, left for us. Boost Fitness Ventures. It's a dry fit T-shirt.
Ooh,
and so,
dry fit.
Yeah, exactly. Everybody's going to. In fact, we don't even have to say T-shirt or dry fit. All we have to do is say free.
Yeah,
right?
Exactly.
So it's the first person who tweets at this point.
Right,
at the show.
Woo Fitness Doctor.
Very good. Good stuff. Okay.
That bell triggers my favorite part of the show. It is now time for the quick Q&A with Dr. A. It's where I shoot a couple questions at the doc and pick apart his brain. Doc, are you ready?
I'm ready. Let's do it.
All right, let's get to it. Number 1, what's the most common injury to those who are active?
This is a tough question. I'm not sure I've ever seen a stat on this. Of course, it depends on the activity. It depends on the sport being played. It depends on even the age of the participants. But I would venture to say ankle roll or some type of ankle sprain.
All right, question number 2. What role does stretching play in the healing of an injury?
Yeah, Tim and I are going to get to this a little later on. One of the things about stretching that I think folks would be interested in knowing is that it elongates the muscle. And whenever a muscle is elongated, it opens up the arteries, and that means blood flow is increased. So more oxygen gets there. And then in the blood, of course, are nutrients, and all of those play a role in the healing of the injury. So that's what stretching does. It elongates the muscle, and it basically opens up the vessels that brings in oxygen and nutrients.
All right, question number 3 to wrap it up. What role does an orthopedic doctor play in injuries?
Well, an orthopedic doctor is an MD. They're a doctor. But what they generally do, they generally specialize in extremities. And what they further do is they tend to specialize in helping people deal with injuries that are associated with sport. In fact, a lot of doctors in this area are former athletes themselves, or a lot of their clients, if not most of their clients, or all of their clients in some cases, are athletes. Recreationally, even up to pro. And so therefore, they have a lot more experience in the area of injuries and taking care of them. So that's generally what that means, is that they're a sports doctor.
All right, that was the quick Q&A of the day. And now, time to send it back to the doc.
Okay, Tim's going to help me along with this. This Men's Fitness Journal, this journal that came out, they listed the top injuries. And some of those included plantar fasciitis. This is where this ligament in the bottom of the foot. And this is associated with overuse, right? A lot of people. Correct. What is the single biggest cause of plantar fasciitis?
It depends on who you talk to. A normal lay person is standing too much on their feet. Talk to an athlete, it's more for cross-country runners, long distance running. Pavement, shoe wear down, they don't update their shoe properly. So it's a stability factor.
No, I know you played college football. Mm-hmm. You dealt with professional football when you worked with Atlanta Falcons. And now
I'll throw in there Carolina Panthers as well. I don't want to get hated.
Very good. New York Yankees too?
No.
You made Troy real happy on that one. And if you throw in the Detroit Tigers, I'd be really happy to have you here. So that is some of your background is in football. What about football players? Do they get that because of the spikes they wear, or is it not real common for them because it's...
The two times that we typically see it are primarily because of cleats.
Yep.
And either, they change certain brands. They go from one to the other. And most likely the larger guys, the offensive linemen, who are carrying around significant more weight than most. And that's two typical times we see them.
They're going to appreciate that you carefully worded that, by the way. Okay, some of the other ones on this list: ankle sprain, ACL sprain, which is anterior cruciate ligament, which a lot of people that watch ESPN, in particular, the bottom line, they see that acronym all the time. A quad strain, a hamstring pull, which is a strain of the muscle in the hamstrings. And then there's lower back pain and then elbow pain. We're all listed in there. And we could talk about each one of those, but our focus today is going to be on the treatment of these. Mm-hmm. Now, there are different forms of treatment, and you deal with all of these in a lot of different manners, a lot of different athletes. Let's talk about them one by one. What role does ice play in the treatment of injuries?
I'm going to use a very big term as vasoconstriction. All that means
that's way too big for me and Troy. Our listeners can handle it, but for me and Troy, it's way too big.
All that means is it squeezes the blood vessel.
Yep.
So it decreases the swelling entering into the affected area. So when you're saying icing, it's immediately post-injury. I mean, you see on the sidelines, you see it anywhere. You want to. It's all. The good thing about ice is it also controls the blood flow, but then it also numbs the pain.
Yeah.
Two big things that people want to control.
Absolutely.
So, ice is huge.
Okay, in some injuries, what would happen to me where one of these injuries maybe or other injuries that we didn't talk about would be appropriate to ice? Now again, just to reiterate that point, immediately afterwards, because one of the things that I remember from the athletic training type classes I took was if you decrease swelling in a short period of time or quickly, then that reduces the severity of the injury, right?
Yes and no.
At least in general.
Yes, yeah.
Okay,
yeah.
I like the yes and no thing. We can say that for everything, right?
Yeah.
Is it going to rain tomorrow to a weatherman? Yes and no. We're not sure.
I say that because some swelling is also deemed beneficial. It's not all bad.
Got it.
Because you're flushing in new fluid, new nutrients and new fluid. So
absolutely,
that's the only reason I said no.
Got it.
But we do want to get rid of swelling quickly.
Absolutely. Okay, so name an injury or some type of, one of the things that we talked about here. What would be some common injuries where ice is applied immediately after the injury occurs?
An ankle sprain.
That's probably the most common,
right? Most common. There are statistics and research to back your statement up. So
that ankle sprain is the most common injury.
It is the most common. Initially, we're talking about acute injuries, even chronic, but mostly acute. So I go play basketball.
Did he just call me cute?
Very cute.
Dang it.
So I go for a rebound. I land on somebody's foot. I roll my ankle. It swells up like a golf ball.
Yep.
Ice it down immediately.
Got it.
Don't try to be the warrior and fight through it.
How long should I ice?
20 minutes on, 20 minutes off, for as long as you can go.
As long as you have the time in which to do that. Mm-hmm. And so, literally, if somebody said, "I listened to what you said, Tim, and I end up icing my ankle 10 times," would you say, "Good for you"?
Yeah, great.
Okay.
I would throw in some other things to do inside that, but yes, good for you.
Watch a little bit of Wingate football somewhere in there, or listen to the fitness doctor. Okay, so an ankle sprain. What other injury would you ice?
I want to touch on hamstring pull because I noticed that's a huge one.
It is big.
And kind of change the, I guess, maybe misconception or misunderstanding of how to treat a hamstring injury. It is based on opinion. I know I'm one athletic trainer, but don't ever stretch it right away.
Really?
Don't do it.
Okay.
Because
after the injury.
After the injury.
Yeah.
So I'm running, weekend warrior playing softball tournaments. I'm turning second, going to third. I pull up with the sniper got me.
Yeah.
I'm pulling up, my hamstring's pulled. Don't start stretching it right away because essentially you tore your muscle.
Yep.
And every time you stretch it, you're reopening it.
Got it.
You want to let it scar down. So for 3 days, let it scar down, let it heal, then start stretching and strengthening and whatnot. But ice is huge.
Got it. Now, before we go on, you mentioned the term weekend warrior. I used that in a previous show, and a listener said, "What does that mean?" Let's define weekend warrior. It's generally the person that goes out once a weekend,
right.
Maybe once every month. In fact, they go on a Saturday or Sunday, but they go at it really hard,
and
they end up, of course, inevitably hurting. I shouldn't say inevitably, but often they hurt something. They're
something. More predisposed for sure.
Yeah. And then the weekend warrior just means kind of like not only just working on the weekends, but they're a warrior in the case of they just have no regard for their body. And then
I like to throw in the fact that they don't do anything pre or post activity. They go out there, they play their hearts out. Great for them. And then Give it 2 weeks, something else is hurting.
Yeah,
That
exactly.
kind of thing, so.
It keeps you people in business.
Yes,
That's one of the
it kinda
great things.
does,
You
yeah.
always have a job. I know, it's wonderful. All right, so what else? So you would ice a hamstring injury, and then you would encourage not stretching that out, at least immediately. Maybe give it 3 days before you start.
The reason I say
something
3 days is because you're going way into depth, but I'm going to say it anyway. Your muscle's actually going to heal into like a checkerboard pattern where your muscles are parallel to each other, the fibers are. So you got to let it heal.
Sure.
And then you can turn it to parallel after eventually. Anyway,
Got it.
that's what that's about. The other thing I was going to touch on, we kind of did our own little special on Woo TV about low back pain. I would say that's probably the number 2 item behind ankle
absolutely.
sprain. Anything low back, just ice it down. I mean, spasm, pull, strain, SI joint dysfunction, anything, you ice it down. Let it calm down. Let the irritation subside before you try to go do anything else.
Got it. Yeah, in fact, I know I've read a couple of times in a couple of different studies that 80% of all American adults suffer low back pain by the time that they're 40 years old. So we should be icing a lot more than we really are.
Also stretching, which we'll get into that.
Oh, absolutely. Absolutely. All right, if you're just joining us, this is The Fitness Doctor. I'm Dr. John Acquaviva from Wingate University. In studio with me to my right is Tim Singleton, the Director of Sports Medicine at Wingate. And then over on the other side is Troy Press. He runs the whole show, basically.
Thank you.
What do we have next, Troy?
Next, we have a question that just came in. This is from XO Bex. She says, "Hey Doc, love the show." So
Love
got
that.
a fan there. But Bex wants to know, can some of the injuries you're discussing be prevented?
They can. In fact, we're going to end the show. I'm going to kind of shortchange this question because at the end of the show, we're going to talk about a study, in fact, and then when we get to stretching, Tim and I are going to tackle that. We have a couple minutes left, so let's get to our fitness nuts. Tell us about this segment, and then who's the nut of the week?
All right, it is now time for the fitness nuts in the news. Did some research here, and I have a guy from New York, so proud of this guy right here. His name is Victor Muniz from Brooklyn. He's currently 48 years old.
Got it.
And he is going for his 4th attempt to row across the Pacific Ocean. And his 3 past attempts...
Where's he leaving from?
He's leaving from New York.
New York, all right.
And his 3 past attempts, he's had some problem with his boat that he built personally. He's ran out of water. He was floating in the ocean for...
Did sharks have anything to do with this?
He told me he didn't tell me. I read that he was floating for 2 days and he cried because he literally had nothing for 2 days, just left out in the ocean.
But he ended up obviously getting saved. And then on
Right.
top of it, probably right the day he got saved, he goes, I have to try this again.
Right, yeah, I got to get back after it. So he is going for his 4th attempt, and this is 250 miles across
Holy smokes.
the ocean. And he has built this boat himself. So every boat he has built, he's had people help him, but he's done it himself. So hats off to Victor.
Well, yeah, hats off to him to an extent, but here he is trying to row across on his 4th attempt. And you and I, all 3 of us know that we could label this guy as a loser because normally it takes us just 1 or 2 attempts, right? We've all done that in 1 or 2 attempts. Yeah, this is a true fitness nut, but why is he doing it? Do we know why he's doing this? Like, is it to raise awareness on something?
No, and the reason why he said that he wanted to get back after it was because after he saw the woman that we talked about on our previous show swim across, he said,
Yeah.
I have to do it. So
If you can swim, I can row.
I can row, yeah.
Very
Especially with the
good.
boat that he built. So we wish him the best of luck.
Absolutely. Do you have any idea when this is going to occur again?
I do not.
But
So-
it's quite possible that he'll fail, and so we can talk about him next year on his 5th attempt.
Right. So
Good
we'll
stuff.
have him on the show maybe.
Okay, that's Fitness Nuts in the News. I'm Dr. John Acquaviva. This is The Fitness Doctor. We're going to be right back after this message.
What is Wingate? A thriving university nestled in a quiet community near Charlotte. Named 6th best value in the South by U.S. News & World Report. Leading the way in the health sciences with pharmacy, PA studies, and nursing. What is Wingate? Big enough to offer 22 NCAA sports. Small enough to attract the best and brightest in the world. What is Wingate? Wingate is you. Wingate University. Major in a great life.
Hi, and welcome back to The Fitness Doctor, the program where we address your exercise, nutrition, and overall health needs. I'm Dr. John Acquaviva, an exercise physiologist in the School of Sports Sciences at Wingate University. Troy Press, what do we have?
All right, Doc, this segment's rundown is Tim Singleton is still in studio here with us. More on common fitness injuries, social media breakdown, and the research minute.
All right, let's get back to it. Today we're discussing common fitness-related injuries as reported by Men's Fitness a few weeks ago. But in particular, we're talking about how to care for these injuries and even how to prevent them. Our guest today is the Director of Sports Medicine at Wingate University, Tim Singleton. And before we get to more conversation on this, Troy, give us the social media info.
If you guys have a question regarding today's topic or would like to request a future topic, follow us on Twitter, Facebook, and Instagram. That's at Woo Fitness Doctor. Or feel free to reach out to us via email. That's woofitnessdoctor@wingate.edu.
Do you wake up in the middle of the night saying the term woo fitness?
I can do it by heart. Yeah, no. Eyes closed. Doesn't matter.
But you don't have any nightmares about it. You have dreams about it.
Just dreams. Just
That's what I
dreams.
want. That's what I want to hear. All right, in the first half of our show, Tim and I were talking about the treatment of injuries, like, for instance, when to apply ice and so forth. Let's talk about when to apply heat. Now, I know this is probably one of the most common misconceptions, right? Or the common question that people have about taking care of injuries. When ice, when heat. Talk about heat first and then the difference between the two.
If you have any questions, the common thing would be heat first, ice after. So always heat prior exercise. If your knee is swollen, don't heat it.
Yeah,
only
that'll
make
just
it
bring
more
up the
swollen.
swelling.
Yeah. So just always heat prior to. It's going to be it's going to help you get looser.
Yep.
Make you feel better.
Yep.
That way you can lead into stretching and other things that you want to do. So always heat prior to.
Got it. Now, is there a point where you should stop icing and only apply heat? Let's say you have an ankle sprain. Okay. You want to apply heat in general just before you go out and you want to be a weekend warrior or just go into your sport again. But is there a point where you say you can stop icing now? My guess has something to do with the inflammation, right?
No, I would say no. You always want to ice post. If you're disciplined
a
enough
week
to do that-
after.
No, like the second after you're done playing.
Okay, but what about a week after?
Still.
Okay, and at what point do you say, I think you can stop icing this now?
From an acute standpoint, it depends. Make sure the swelling's out. Once the swelling is pretty much gone, and usually swelling's gone, pain's gone, then you can stop icing.
Or you're going to take 5 or 6 weeks to row across the Atlantic, right? Then you can take a break from it.
Yeah.
All right, so... and what are the ways to apply heat?
What we use typically in the athletic training room is moist heat packs.
Okay.
I know not everybody has those available. Hydroculators sitting in their home. The plug-in heat packs you see.
Yep.
Just be careful you don't set anything on fire.
Yep. Always a good thing.
You have the topical analgesics, which are like BioFreeze and Flexol. Those work to an extent.
Okay.
I'm not a firm, huge believer on it.
And the main thing is because we don't know if it penetrates as deep as it. But actually, that's been a question about icing too, because sometimes the deep tissue is not getting. There's no cold.
Right.
There's no extreme temperatures that are getting to the injury in some cases as well when we ice.
True.
Right?
The question is, what are you trying to ice?
Yeah.
If we're trying to ice muscle, then very accessible ligaments, then you're probably going to get it. But if you're trying to, do the fourth fiber of the way down deep,
or your liver, you're probably not going to get it.
Probably not going to get it.
All right, let's move on to anti-inflammatory drugs. This is a big way to prevent, or not necessarily prevent, but actually some people do that as well, but mainly to treat injury. So let's talk about some of those. Like there's Advil and Motrin, ibuprofen, Aleve, naproxen, or some people call it naproxen, and then of course aspirin. Right? Is there one over the other, first of all, that you suggest?
We dish out a ton of ibuprofen, a lot, and we do pre, post, during injuries to control swelling. I mean, ideally, that's what it's for. The regimen is, what we tell our athletes, up to 800 milligrams every 4 to 6 hours.
Got it.
Obviously, with food. I mean, we want to make sure everybody's not developing stomach ulcers.
Yeah.
But that is probably the most widely used NSAID that we have.
Got it. And said it's an acronym, non-steroidal anti-inflammatory drug. And the ones we talked about, Advil, Motrin, aspirin, and so forth. And if it's 6 to 8 hours, we're talking about 3 administrations a day, basically, right? And for how many days would you suggest to have this regimen?
What we do is typically how we, again, our athletes are under careful watch.
Yeah.
We're not going out there and just leave them to themselves. We do it until the injury is done.
Got it.
Until it's taken its full course. Primarily, we're a lot heavier on the administration and the acute phase.
Got it.
Get into post-acute or subacute, and into full back to play. We're just if they're injured or hey we have some minor residual swelling, then we'll offer that again.
So tell me this: if somebody's say they've rolled their ankle, they have a hamstring pull, and they're on their 7th day of 3 times a day, that doesn't necessarily raise a red flag for you, as long as it seems that healing still needs to be occurring, right? Okay. If you're just joining us, this is Dr. John Acquaviva. You're listening to The Fitness Doctor. Troy, we have a question from a listener.
Yep. We have a question here from Joey in Huntersville. And Joey's question is, if injuries are bad, why do some trainers say, no pain, no gain?
This is an age-old saying, right, Tim? No pain, no gain. And, of course, what this is referring to is when trainers and like personal trainers and fitness professionals, bodybuilders, for instance, recreational or not, they're referring to the fatiguing of the muscle. And when the muscle's fatigued, there's lactic acid buildup. It causes like an acute pain, like a burning sensation. But we're not talking about actual pain. Like, in other words, forgive the analogy here, but the difference is like ooh versus ouch, right? Like the ooh part is like, wow, my muscle's burning. I'm doing, I'm on my 12th rep of bicep curls. But ouch is my ankle's been injured or my.
Another analogy you could say: are you hurt or are you injured? There's a difference.
Let's hear the difference.
Injured is you're injured. There's like a torn ACL or something you can't go. Are you hurt? It means you just got to let minor bump and bruise, get back out there.
Yeah, exactly. And how many times do you want to scream that in somebody's ear?
Many.
Yeah, exactly. And boy, I was just going to ask you, at what type of athlete or what athletes, guys, girls, do you want to utter that the most? But we'll say that for off air. How's that? I think that might be.
I don't mind saying it on air.
No, let's hear it.
You have to develop the relationship before you can say that.
Got it.
That's a nice, easy way to say it.
But in truth, it doesn't matter whether they're hardcore rugby or football players or whether they're running cross country. The fact is there's still some people that don't quite know how to manage their injury, don't know how to manage pain. And if they're in any type of discomfort, they feel that that's the call to not compete.
The biggest advice we would say, if you cannot protect yourself in the sport that you are playing, don't play.
Got it.
But if you can protect yourself and you're like, hey, I'm on 95, 80%, you still you feel like you're strong enough, go have fun. As long as you're not being a detriment to your own good.
Yeah, gotcha. Okay, so we talked a little bit about these anti-inflammatory drugs. Stretching, we already talked about this. Stretching, it can be really beneficial, especially in the days that are where there's been a good amount of healing time that's occurred. Like maybe after like the third day, we know it to be really beneficial because the muscle is trying to fully repair itself. And then when we elongate the muscle, it allows more blood flow. And more blood flow brings in more oxygen and more nutrients like proteins and amino acids that make up protein, vitamins and minerals, all which are part of the healing process, right? Mm-hmm. So talk a little bit about stretching. So if somebody has a hamstring pull and it's been, say, 4 or 5 days and they're feeling fairly comfortable, but they feel a slight twinge, what's the stretching protocol that you put them through?
Again, I've had the benefit of working under some great athletic trainers, and so I picked and pulled their brains, and throughout my young career.
Yeah.
But usually we stretch to discomfort, and then we back it off a little bit. You don't want to stretch to where there's like a significant amount of sharp pain.
Now this is static stretching, right? In other words, get to the point you can't go further, just hold it.
Back it off until when you feel no pain, then hold that stretch.
Yeah.
And then you'll
For how long, Tim?
However long. I mean, it's pretty much however long I feel like holding it until I get tired.
but the general suggestion is at least 15 seconds.
Yeah, we usually
go
for 30. Yeah, we go for a nice long static hold.
Yeah.
And then from there, you see the progression daily. It's pretty quick. I mean, as long as you like I said, you want to handle it so well on the front end that on the back end, the recovery time is much better.
Got it.
So stretching is huge. I think adding to what you're saying in the blood flow, we just like to say interstitial fluid. It's a WD-40 of your body.
You like to throw out all these big words that even the host has no idea what you're talking about. Troy knows, but
it's just all. It basically it lubricates your own body. So if we're talking about joints specifically,
sure.
We have a hip joint and say my IT band's tight. That's going to create possibly bursitis that would lead into snapping hip syndrome, which cross-country runners deal with a lot.
Yeah.
So if they stayed flexible, that not saying it will never happen, but your chances are much less likely.
Oh yeah, in fact, that's going to lead into our research minute here, where we talk about the effect of stretching. But as we can even say even before we talk about any research, is that it doesn't matter what you do, injury is going to happen because there's contact, because there's poor form, whatever the case is in a sporting situation. Now, I think you would agree with me that we're not trying to diagnose any injuries here on the air. When there's any doubt, they need to go see a professional, right? Okay, and I know,
professional.
Say that again.
A healthcare professional, not just a professional.
That's right. We have to not a restaurateur professional. All right, we have one more segment, the Research Minute. Talk to us about this.
All right, Doc. This is a part of the show where the doctor himself has taken his knowledge a step further and done some research on an article that's fairly recent on today's topic. So, Doc, why don't you take it away?
Okay, this is called a pragmatic randomized trial of stretching before and after physical activity to prevent injury and soreness. It's out of the British Journal of Sports Medicine, 2010, so relatively recent. And their objective was to determine the effects of stretching before and after physical activity on the risks of being injured and soreness. Now, what they did is, actually, it was a really sound study. They had over 2,000 participants, and they had a control group, and then they had people who exercised and then ultimately stretched. And these people were in a 12-week workout program, and they were asked to stretch 7 different lower, primarily limbs, for 30 seconds each time, what's called static stretching, where you go down and you actually hold it, or whatever the stretch is, you hold it for a good 30 seconds. And then the control group were exercising as well, but they did not stretch either before or after. And I don't think to many people's surprise, what they found out was that the stretching did not reduce the risk of injury. In other words, people still got injured as a result of working out, but it did statistically and significantly reduce the risk of soreness, which is a pretty common after effect of exercise, isn't it? Mm-hmm. So what would you think this was going to say? That this probably didn't surprise you in any way, right? Because there's no way to completely prevent injury.
I know you and I spoke about this pre-show.
Yeah.
I'm surprised. I really would like to see what they classify as an injury. Is an acute injury versus a chronic.
Well, of course, it's written here, but we'll talk about it off air a little bit more. But yeah, I know. In fact, it does take some more explanation. But I think the main point from this is that, as we talked about off air, there's really no way to prevent all injuries. But you and I would both agree that in some cases, if you stretch prior to, that it's going to prevent probably some, especially, for instance, like it might lessen the chance of having a hamstring pull or an ankle roll, whatever the case is.
Oh, for sure. Absolutely.
Okay. All right. So we're, as always, we're going to post this on social media. So if anybody wants to read this in full, they can do that. And we have a couple minutes left here, and I want to do the takeaway from today's show. We're talking about treatment of injuries, ice, heat, anti-inflammatory drugs, the role of stretching, and so forth. They all play their role, and the more care that we have that's appropriate, the quicker the healing time will be. And it's quite possible in things like stretching, for instance, it might even actually help prevent it. I want to thank my guests here today, Tim Singleton, the Director of Sports Medicine from Wingate University. And folks, remember that you don't stop playing because you get old. You get old because you stop playing. Please join us next time on The Fitness Stuff.
Planning your next step in life? Come complete your education in a dynamic, caring environment at Wingate University. Enrollment and construction have skyrocketed in the past 2 decades as students pursue challenging and rewarding degrees in fields like the health sciences, business, and education. U.S. News & World Report has named Wingate University the 6th best value in the South. Visit one of our 3 great campuses, Wingate, North Carolina, Hendersonville, or Charlotte, or check us out at wingate.edu. Major in a great life at Wingate University.